Hi, everyone. Good evening, and thank you for joining us. We have with us Amanda Flake. She received her master's degree and a doctoral degree in social work from Verzleiler's School of Social Work, where her dissertation focused on the clinical implications of countertransference in the treatment of addiction. She completed psychoanalytic treatment at the Institute of Contemporary Psychotherapy in New York City. And prior to joining the dorm in 2011, Amanda was a program director for New York Center for Living and Flatbush Addiction Treatment Center. Amanda has specialized training in DBT, CBT, addiction and co-occurring disorders, eating disorders, family therapy, EMDR, and motivational interviewing. With that, I welcome Amanda.
Thank you. Thank you so much for having me. I really appreciate being able to talk to parents on this topic. As Divya said, my name is Amanda. I have worked with teenagers who struggle with various different mental illnesses and addiction, and young adults as well, for my entire career, actually. In addition to that, I am myself a recovering alcoholic and drug addict. I got sober in 2001. I was 22 years old and celebrated my 23rd birthday in rehab. I grew up in Scarsdale. I say I grew up in the other Scarsdale on the other side of Central Avenue, and went to Scarsdale High School. So, when I speak to you today, I'm certainly going to speak to you at points in times wearing my professional hat, and at points in times I'm going to talk to you based on my own personal experiences as being somebody who struggled with substance use in their teenage years and throughout college as well, and give you that perspective. Please, during this presentation, I know that forms were sent out in advance where you can ask questions. There's some people who have asked questions in advance while I am speaking. If you have more questions, continue to fill out the form. I'll be looking at it as I'm speaking. I often find that the time to answer questions is the time that feels almost most productive for parents. So I welcome any and all questions. But I will do my presentation and do the slideshow to get us started, and I will leave time at the end. So with that, I am going to share my screen. And just to start, I think it's important to understand what is addiction, what is a substance use disorder. And there's sort of official diagnostic terms for addiction and the way that we define it. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and individuals' life experiences. People who have an addiction issue typically use substances or engage in behaviors that become compulsive and continue using those substances despite the harmful consequences. In layperson's terminology, I would say that somebody has a problem with their substance use if it's causing problems and they continue to use the substance anyways. For instance, if I was to walk by a stove and I saw the red light was on the stove and I touched the stove and it was really hot and I burnt my hand, maybe I would touch the stove one more time if I saw that red light on, but I probably wouldn't touch it again after that. After 2 times of experiencing getting my hand burned when I see that red light on, I would know I'm not going to touch that stove. I don't want to get burnt again. Somebody who struggles with a substance use disorder is going to continue to use even though these bad things keep happening to them when they are using. There's criteria that we look for according to the DSM, which is our diagnostic manual. And I'm just going to go through these super quickly. One is taking the substance in larger amounts and for longer time periods than you meant to. Wanting to cut down or stop using the substance, but not being able to. I myself, so many times in my childhood and my teenage years and my young adulthood would say to myself, okay, I'm going to stop for the next week. I'm not going to drink or use drugs. And I really meant it. And then, a day, 2 days into that deal I made with myself, I would be back to doing what I was doing. Spending a lot of time getting, using, or recovering from substance use, having cravings or urges to use, not managing to do what you should do at work, at home, or at school because of substance use. So these outside areas of your life begin to, or can in some cases. In my case, that actually didn't happen. I was a very high achieving student and athlete, and I was using substances. At the very end, all that other stuff happened, but for a very long time, it didn't. Continuing to use even when your use is causing problems in your interpersonal relationships, giving up important social, occupational, or recreational activities because of substance use, using substances again and again, even when it puts you in danger. So that stove example, continuing to use even when you have physical or psychological problems that could have been caused or made worse by the substance. This would be somebody who maybe has a diagnosis, their doctor has told them that their liver is being negatively impacted by their substance use, and yet they continue to use. Somebody, and let's remember, tobacco is a substance, somebody who continues to smoke even when their lungs are being damaged. Needing more of the substance to get the desired effect that you want. This is tolerance in essence. So the first time that you experiment with alcohol, you might feel tipsy after 1 or 2 drinks. After doing this for a period of time, you have 1 or 2 drinks and you don't feel tipsy. Now you need 3 or 4. So you continue to need more and more of the substance. And also the last one is development of withdrawal symptoms. So basically, you feel really awful when you don't have the substance. And then when you get some of the substance in you, you feel normal again. So feeling very anxious, having some tremors, and then you use the substance and you feel great again. The tremors go away and you don't feel anxious anymore. Typically, when we see 2 or 3 of these symptoms, that indicates a mild substance use disorder. 4 or 5 indicate a more moderate substance use disorder, and 6 or more indicate something that's more severe. What we know about addiction and substance use disorder is that they are progressive illnesses, like many illnesses. Left untreated or undertreated, they will get worse over time and not better. So it's always best to intervene early so that it doesn't have to progress to some of those latter stages. There, and I call it sort of old school addiction treatment world. There was, and even in AA and NA and sort of the old school days, there was this idea that got thrown around that somebody has to hit rock bottom before they can get better. Or that somebody has to want to get better before they get better from a substance use problem. And I really, that those 2 beliefs, neither sits right with me, and both, quite frankly, scare me a bit, because for some, hitting bottom is catastrophic. For some, hitting bottom is death. It's overdosing. If you're on an elevator and you know it's going down, you don't need to go crashing down to the basement before you can get off and remove yourself from the harmful situation. And what we always want to do as treatment providers is work with people to say, hey, if you stay on this elevator and this course that you're on right now, it's only going down to the basement. Let's get off here at the 8th floor. It doesn't have to get so bad for you to get better. And to parents, I'll often say, your child doesn't have to want to go to get help or to get treatment for treatment to work. In all of my years of doing this work, it is very rare, very, very rare to see a 16, 17-year-old walk through the door and say, I am so happy to be in treatment. I'm so glad to be here. They're usually coming in angry, cursing, saying their parents are X, Y, and Z. They don't have a problem. They don't need to be here. And that's okay. It's our job as providers to help them to get to a place where they can see that this is a problem, and that there is work to be done, but they don't need to want to be there in the beginning. So drugs, what is a drug? Drugs are a medicine or other substance that have physiological effects on us when they're ingested or otherwise introduced into our bodies. I'm going to go through a list of drugs. And again, you all probably know this and a lot of this information, but I think that it's important to go through this list. And when I'm going through this list, I want you to ask yourselves and keep in mind, which of these drugs are legal? Which of these can be found in your home? And how many of these are, quote unquote, I want to say easy to obtain? Obviously, if they're in the home, they're easy to obtain. But ask yourself these questions as we're going through this list. So alcohol is a drug. Alcohol actually is probably one of the most dangerous drugs, in my opinion. It is one of the only drugs that somebody can actually die withdrawing from. If somebody has a very significant alcohol addiction, we would never tell them to just stop cold turkey, because doing so, they could have a seizure. Many bad things could happen. We would need to hospitalize or go into a detox where they are medically overseen as they are withdrawing. You cannot die withdrawing from cocaine or even opiates. It's really uncomfortable. It's not fun. You can die, you can overdose from those substances, but not the withdrawals. Benzos are the other one. You would never tell somebody to stop cold turkey. That's Klonopin, Xanax, Valium, but alcohol is a drug. And 1/3 of 15-year-olds have experimented with alcohol. Caffeine is a drug. Tobacco is a drug. Marijuana is a drug. Hallucinogenics, mushrooms, acid, LSD, mescaline, DXM, ketamine, PCP are all examples of hallucinogenics. Remember that cough medicine, DXM, so in our homes sometimes, certainly in drugstores, you can hallucinate, and kids can abuse it. Inhalants, aerosol sprays, gases, nitrates, solvents, glue, whipped cream bottles. I will put on my personal hat right now and share that this was something we did in high school, and really easy. I even remember, like, one day my mom asking, like, why are the whipped cream bottles, they're not like working? I don't know, but you can inhale and get high from those. Opiates, heroin, Percocets, so pill forms, Oxycontin, codeine. We'll talk more about fentanyl. That's a big thing that we need to talk about. Methadone. Prescription painkillers are something that are certainly on the rise in terms of misuse by our younger populations. Sedatives, hypnotics, these are central nervous system depressants. They slow brain activity. People use these substances to help them calm down. So when we think about things like benzodiazepines, which are prescribed oftentimes, things like Xanax and Klonopin, Ativan, hypnotics, which are sleep medicines like Ambien, some antihistamines like Benadryl, Dramamine, Dimetapp, these things can certainly be abused. And then stimulants, these speed us up. They speed up the messages traveling between the brain and the body, and they can make us feel awake, alert, confident, energetic. When we think about stimulants, we also often think about cocaine, crack, but there's caffeine. Nicotine is actually a stimulant. Diet pills, Medications that are prescribed for attention deficit hyperactivity disorders are like Ritalin, are stimulants as well. So when we look at this list, you all can make mental notes in your own minds, but the majority of this list of substances can be found in a home environment. I know that a lot of parents often sort of fear their children using substances and how they're going to get these substances and who are the people dealing drugs. And I will tell you from personal experience and professional experience in the kids that I treat that the overwhelming majority of kids first experiment with substances that they are obtaining from their homes or their friends' homes. If it's, finding alcohol in their parents' liquor cabinets, and everybody takes just a little bit. And if everybody takes a little bit, they end up having, enough to experiment with. Marijuana is legal, but even when it wasn't legal when I was growing up. And we all knew which friends had parents that smoked pot, and we would go in and, again, just take a little bit of their marijuana. We would go into medicine cabinets to get prescription medicines. I mentioned the inhalants. So in the beginning, it's less about going outside and getting it from drug dealers or getting fake IDs and getting it from, local liquor stores. It's stuff that's found in the home, or older siblings also, or people that sometimes help in that instance. Which of these substances are easy to get? All of them, even if they're not found in your home. We live in a different world today with the internet, with social media, with different social media groups. It is quite easy to get substances. And I say this, it's not fun to feel scared or to feel anxious, but I think we all need to know what the realities are. And these are the realities in today's day and age. It was the reality however many years ago when I was in high school as well, but it's more so now with cell phones and with the internet. I wanted to take a separate and aside moment to talk about fentanyl. Fentanyl is a synthetic opiate. It is an illegally manufactured synthetic opiate that acts on the same targets in the brain as natural opiates do to produce even greater effects. Fentanyl is extraordinarily dangerous and deadly. And fentanyl is being found in all drugs now, including in marijuana. Therefore, the danger associated with taking drugs is greater now than it has been. When we look at opiate use amongst adolescents, it's actually really plummeted recently. We're seeing less opiate use amongst adolescents, yet fentanyl overdoses and overdose deaths have tripled among teens over the past 2 years. This is because of the fentanyl-laced marijuana. It's being laced in many different drugs, but especially in marijuana. So unsuspecting users are ending up with fentanyl in their systems. So, youthful experimentation just takes on a different meaning in the age of fentanyl. What are some of the warning signs that we see associated with substance use? There's a couple different ways that we can look at this. We can look at physical symptoms, bloodshot eyes, changes in appetite and sleep patterns, if your child smells like marijuana, they'll often say like, it wasn't me, it was my friends, this and that. It's if they smell like marijuana, they were likely using marijuana. If their breath smells like alcohol, they were drinking alcohol. I've heard a ton of excuses from the kids that I work with as well. But there's certain things that, you just can't really make up excuses for. Runny noses, sniffling, sudden weight loss, weight gain, obviously slurred speech, impaired coordination. If they're coming home looking like they're not walking well or talking well, it's likely because they've been using. Psychological and emotional changes in personalities, mood swings, irritability. And I know this is a hard one because they're teenagers, and teenagers are going through hormone changes. They're irritable, not on substances, but if you see a shift, that is an indication. Anxiety, paranoia, lack of motivation, or periods of unusual or increased energy can also be a sign. In terms of behavioral warning signs, we want to look at their attendance and performance at school, if they're just really secretive, if they've suddenly changed their friends or the things that they like to do. Clearly, legal troubles would be an indication. An unexplained need for money, stealing money or other possessions from the home, using drugs under dangerous conditions, like if you notice that they're driving while under the influence, having unprotected sex, increased drug tolerance is another one. A general loss of control, life revolving around drug use. Some of these things you wouldn't necessarily know. They would be experiencing it. And again, continuing to use regardless of negative consequences. I think that when we think about who is at risk and what does addiction look like? Like, what is the portrait of addiction? I tell people that addiction is a disease that does not discriminate. In an AA meeting, you'll often hear people say that alcoholism or drug addiction can impact somebody who sleeps on a park bench or in a bed on Park Avenue. These people have different accesses to resources to get help for their addiction, but addiction can impact anybody. And addiction, I'll speak for myself here. Like I said, I went to Scarsdale High School. I was a competitive figure skater. I graduated and went to Colgate University. I went to law school after that. You can be high functioning, some people can, in certain areas of life and still have a major substance use issue. For me, I would use the fact that I was doing well in these other areas of life to keep people from bothering me about my substance use disorder. So for instance, I probably had to go to the hospital for different types of alcohol or drug-induced types of situations that happened both in high school and in college numerous times, whether it was because I fell and needed to get stitches, or I was passed out and my friends couldn't get me up, or because I got a DWI. And these negative things kept happening, but I would keep saying, but I'm okay because I'm doing well in school and I have friends, and you can't pull me out of college and make me go to treatment. I have a 3.7 GPA. So as parents, what I'm telling you is that it doesn't matter if some areas of life are going well. If there's repeated negative things happening because of substance use, like hospital visits, DWIs, getting in trouble in different scenarios, it's worth looking into. The person struggling with substance use doesn't want to give it up because it's serving a purpose. You're holding on to it for dear life. I did not want to give it up because it made me feel better. It made my sadness feel better. It made my anxiety feel better. So anybody who threatened to take it away from me, I would come up with every excuse and reason in the book why they were the crazy one and I was okay. I was fine. And I think that is a gift of many people who struggle with substance use, is deflecting from themselves being the problem and pointing at other things being the issue or the problem. Risk factors that we should look at are obviously genetics. Addiction is not a matter of weak willpower or a lack of morals or ethics. There are chemical reactions that happen in the brain of somebody who has this illness that don't happen in the brain of somebody else. I had a group of people that we all experimented with alcohol or pot or whatever it was at the same time. They did not end up in rehab. I did. My brain, my body, I believe, has an allergy to substances. Once I have a little, I not only want more, I need more. There's a saying, one is too many, 1,000's never enough. Once an addict or an alcoholic has a little bit of a substance, something happens in the brain where they go into just more, needing more. The good news is that if I don't have any of it, I'm fine. The disease is in remission. I don't need more. No chemical reaction gets set off. The allergy doesn't get triggered. According to the National Institute on Drug Abuse, up to half of your risk of addiction to alcohol, nicotine, or other drugs is based on genetics. If you have family members who've experienced addiction, you are just more likely to experience it too, up to 8 times more likely. So if there is addiction in the family, it's really important as parents to have honest conversations with your children. When my kids are old enough to have those conversations, I will have those conversations with them, because they need to understand that they are at greater risk than their friends, that while their friends might be able to experiment and be fine, if they experiment, there's an increased chance that they could develop this disease that can be life-threatening. There's environmental factors that put people at risk, like a lack of parental involvement, obviously abuse and neglect. If there's a ton of peer pressure going on in the environment, that puts kids at risk as well. Also, people who have secondary diagnoses, so certain temperaments like extreme recklessness or impulsivity, or severe anxiety. If somebody has a mental health diagnosis, they can be more at risk for a substance use disorder. More so, however, if that mental health diagnosis is not treated. If it's treated, the chances of needing to turn to substance diminish greatly. And I'll give an example of this. Let's say that somebody struggles with anxiety or depression, something that I struggled with, and they're not getting any treatment for it. They're just living on a day-to-day basis with these symptoms that are not fun to live with on a day-to-day basis. They don't feel good. They feel pretty awful, actually. And then you discover that when you drink alcohol, you feel less anxious. You forget that you're feeling sad. You feel lighter. You feel more, everything just feels better. You quickly learn that, this feels better than I feel when I'm not using alcohol. So I'm going to use alcohol again. It's the one time that you experience relief. It's self-medicating those symptoms, versus if somebody has that diagnosis and they're in therapy, if they need medication, if they're on medication, there's less of a need to self-medicate away those symptoms. So getting good treatment for a mental health diagnosis is protective from a substance use problem. Childhood trauma, particularly repeated trauma and loss, also puts people more at risk for a substance use disorder. The last thing that I want to talk about in terms of who is at risk is early use. The earlier in age one's first experimentation is with alcohol or drugs, the higher their risk is of developing some type of substance use disorder. According to studies, youth who begin consuming alcohol prior to age 15 are 4 times more likely to suffer from alcohol dependence during their lifetime. What we also know is that use of any substances impacts the brain, and the brain, particularly areas of memory and processing, and our brain is still developing well into young adulthood. So we really, as much as we can, want to delay the first experimentation. When we do that, we decrease the risk of problems with the brain, and then also problems with later on substance dependence. So this is really what I want to spend the latter half of this presentation focusing on, is how do we talk to our kids about all of this? Because there's a lot of different messages out there about talking to our kids about drugs and about alcohol. I read a great article in the New York Times. I can't remember when I read it. I want to say it was like a month or two ago. It was called How to Talk to Kids About Drugs in the Age of Fentanyl. And I think they really, they like nailed it in terms of the messaging and how to effectively talk to your kids so that they'll actually like hear what you're saying and absorb it, and that it doesn't have the opposite effect. The reality is that nobody that I know, at least, has yet found a way to eliminate youthful risk-taking and impulsiveness. That is part of being a teenager. That is part of sort of a normal stage of adolescent development. This is what teenagers do. And that's okay. It's probably for the best, because this is age appropriate, and it can also drive really wonderful learning and creativity. That said, we want to reduce the odds that the impulsive things that kids do will kill them, period, or cause them grave harm. They will be impulsive, and we want to protect them from the grave negative impacts of that impulsivity. So the first thing that I really tell parents is that, and teachers, any adults, is that reaching adolescence really requires earning their trust. And you earn their trust by being truthful. Simply trying to instill fear does not work. I wish it did. It would be so much easier if it worked, and it doesn't. Accuracy over hype. Fear tactics are not effective in changing adolescent behaviors. We cannot scare them away from drug use with exaggerated and absurd stories about Halloween candy and multicolored fentanyl pills. They will think, if you talk to them like that, they're going to think that you, as the adult, are clueless and have no idea what you're talking about. And you kind of discredit yourself in that process. That said, teenagers do need to be made aware of the very real risks associated with drug and alcohol use, and we need to challenge beliefs that are simply not true. They will listen when they recognize that they are being given honest and accurate information about the genuine dangers. So, For instance, they need to know that pills sold as prescription pills are often counterfeit and of unknown dose and purity, and therefore dangerous, period. They need to know that abstinence is the safest option, and that in reality, and I didn't know this as a teenager because my world became very small. I surrounded myself with other people who were engaging in the same behaviors that I was engaging in. So in my mind, I thought that everybody in college uses drugs and alcohol. I was normal because everybody was using them. And I surrounded myself only with people who use them, which made me feel better about my use. But that's not the truth. It's just not. There is a whole world of teenagers and college kids out there who don't use. They don't. And I think that, it's when the kids that I work with kind of have that aha moment because we help them to meet other kids who aren't using, it's like, it's life-changing to them. They're like, oh, wow. So there really are other kids who don't use. I don't have to use to have fun and to just be a kid. The other thing that we need to accept as adults is that not all drug use can be prevented. It can't. Not all alcohol use can be prevented. It's impossible. So instead of focusing only on abstinence, we also need to talk to kids in a manner that aims to prevent the highest risk behaviors and address the personal and environmental factors that are most likely to lead to addiction. So what does this mean? A lot of people will say to me, but if we teach them anything beyond just saying no, aren't we condoning drug use? And my answer is no, we're not condoning drug use. We're not saying it's okay to use, but saying just say no it's not realistic. We need to, if we're sharing ways to reduce risk, that's not encouraging them to get high. That's simply telling them, if you're going to do this, even with all this information that I've shared with you, you need to do it in a safe way. It's a similar debate with sex education. There's little evidence that providing accurate information about having safe sex is, leading to more sexual activity. It's providing kids with proper safety protocols. So if they do have sex, they don't end up getting a sexually transmitted disease or an unwanted pregnancy. It's the same thing with talking to your kids about drugs. So given the toxicity of the drug supply now, given the fact that we know that fentanyl is in a lot of drugs right now, we need to protect young lives by targeting the factors that cause the most harm. So simply saying to them, just say no, sort of places the burden on them with denying them the tools that they need to be able to make good decisions to themselves. So what I would say is we need to speak plainly to them about fentanyl. We need to provide accurate information about prescription pills. We need to provide accurate information about alcohol, about the medicines that they're finding in medicine cabinets. We need to tell them about fentanyl detection strips. There are strips that you can use if you're buying marijuana or finding marijuana in your parents' home or wherever it is that you're getting it. There are detection strips that you can use to test the drugs that you are using before you use them to make sure that fentanyl is not in them. Is that condoning using the marijuana? No, it's saying you shouldn't use marijuana. And if you do, you need to do this because if you don't, you could be putting your life at risk. We need to teach kids not to use alone. We need to teach them to, if they're going to use substances, even if it's marijuana, whatever it is, they need to have naloxone nearby. Naloxone is something that you can administer to somebody who's in the middle of overdosing if they've had either too much opiates or fentanyl, that can save a life. It can reverse the overdose. And what we've found is that when you share all of this information with kids around what they need to do to protect themselves if they're choosing to use substances, even knowing all the associated risk, is most of the times they say, geez, this isn't worth it. Like, it's like, this is a lot to do to just use some pot, like to have to do all this, to have to get fentanyl detection strips, to have to get naloxone and have that available. In light of all that effort that I need to do to reduce risk, it's kind of not worth it. And for the ones that don't feel that way and they decide to use anyway, at least we're protecting their lives. And again, I know that this isn't always the popular message. This isn't always the message that parents want to hear, but I promise you, it will save lives. And again, in the age of fentanyl, we really need to arm young people with accurate information. And we need to accept the fact that some kids are going to use anyway, even knowing all these risks. And if they're going to use anyway, let's teach them how to use safely in a way that's not going to put their life at risk. We always want to listen and validate feelings. And we really want to provide opportunities for social and emotional learning. As I spoke about earlier, many kids use because using provides them with something that they're not getting from themselves internally. They're lacking certain skills or they're feeling a certain way, whether that's anxious or insecure or afraid or awkward socially or sad, and using makes them feel better. We need to give them other skills that they can use so that they don't need to rely on the substance to feel better. So any opportunities that we can give kids for social and emotional learning, we want to give to them. We also want to create an environment where kids feel like they're validated and they feel like they're heard, that they're not judged, and then they're not going to feel shame. If they come to you asking for help or saying that they've used some substances, we don't want them to feel, punished or ashamed. We want them to feel really validated and let them know that they were so brave and courageous and that you're there to talk to them and understand what has been going on. We want a role model. We want to lead by example. This is another really big, important point. Kids actually watch you probably more than they listen to your words, a lot of teenagers. So they're going to see how you are consuming alcohol and or other substances. Are you getting designated drivers? Are you using moderately, or are you not using moderately? Are you smoking pot? Is it in your home? Do they see it? The last point, which is really, really, really important, is, and I know there's a lot of mixed messaging on this one. Some parents feel like allowing teens to consume alcohol at home will reduce risks associated with underage drinking, like drinking and driving. However, you are sending the message, if you're allowing them to use alcohol in your home, that it is okay to break the law, because it is not legal to drink until they're 21, and that it is okay to damage your brain, because we know that alcohol damages the brain of a young person, and that it's okay to drink, right? If you're allowing them to drink in your home. And we don't want them to have that confusing message. What we know is that the research is showing is that teens whose parents give them permission to drink at home are 2.5, 2.6 times more likely to binge drink. They're 2.5 times more likely to demonstrate symptoms of a substance use disorder, and they're more likely to suffer from harm related to alcohol. When you allow your kids to drink at home, you give them the idea that it is okay to use, period, and therefore they will be more likely to use outside of the home in a harmful manner. You don't have to be the cool parent. You don't. Sometimes it's our job as parents to be terribly uncool and to lay boundaries. Your children might not always in the moment appreciate it, but I promise you it makes them feel more safe. because they don't have the full capacity to lay the boundaries for themselves. They're too young right now in this stage of development, and they need an adult, they need an outside ego to help lay those boundaries for them. So I often tell parents, especially in smaller districts, when you know one another, that you can all come together as parents and sort of make a pact saying, you know what, none of us are going to allow this in the home. So this is what we're going to do as parents. This is the message that we're going to give our kids. And it really is the less confusing message for children. So with that said, I am now going to go into and refresh this document because I know that there were questions that came in, and open some of these. I want to also just say that any question that you put in the document is totally anonymous. So nobody will know that you've asked it. I don't even know who's asking what questions. So please ask whatever questions, and feel free again to ask me a question either in a professional capacity or from my personal experience of being somebody who, as a teenager, struggled with a substance use disorder. I'm happy to answer in either capacity. The first question is, to what extent do you think children with untreated ADHD or an overlooked learning disability are at risk for substance use, depression, and or suicide? What do you see in your practice? So my answer is that I know we're asking specifically about ADHD and learning differences, and I will speak to those specifically. But as I said earlier, any untreated mental illness is going to increase the risk for substance use because people find ways to self-medicate. It's survival. It truly feels like survival. When it comes to things like ADHD, or an overlooked learning disability, there's also other factors going on. When kids are struggling in the classroom, they feel really bad about themselves, right? Like it doesn't feel good to feel like, gosh, no matter how hard I try, I'm not as smart as Billy or Joe or Jane. And what's wrong with me? What's wrong with my brain? I know there's a lot of fear around prescription medications, especially prescription medications for conditions like ADHD. They are stimulants, right? They are on that list of drugs. They are mind and mood altering. However, when you have a true diagnosed condition like ADHD, and it has to be a correct diagnosis. I think it's a diagnosis that probably gets overused. You have to meet the criteria. When you have that diagnosis, your brain doesn't make chemicals in the same way as somebody who doesn't have that diagnosis. So the medication helps the brain, just like a diabetic who needs to take insulin. That's the same thing that the medication for the ADHD is doing. So if somebody doesn't have ADHD and they take a stimulant, they're going to feel really, really, really hyper, right? It's like speedy. Somebody with ADHD takes that stimulant and they calm down. It has the opposite effect because it's regulating their brain. If you don't give that person that medication, they will find something else to calm down their brain eventually. Pot, alcohol, benzos, something, because it feels intolerable to have a brain that doesn't do what you want it to be doing. So absolutely, I would say that the risk increases if those conditions are not being treated. If they are, then we don't see an increased risk. When is the right time to consider rehab for a teen? Oh, this is a hard one. So rehab is a big deal. You're removing somebody from their home, you're removing them from their school, from their friends. I always like to first try other less restrictive interventions before jumping to rehab, unless somebody is using substances in a way that is putting their life at risk. Then we just pass all those other levels and you go to rehab. If they're not using in a way that's putting their life at risk imminently, I mean, because all substance use is dangerous. But let's say they're, smoking pot on a daily basis, it's interfering with their performance at school. Maybe in that instance, I would start with some more intensive outpatient work, certainly involving them not just in individual work, but group work is really, really powerful. One of the best parts I think about working with this population in a clinical setting that's more intensive, in the setting that I work in, we offer a ton of group work. And like I said earlier in the presentation, most kids don't enter into treatment wanting to be there, right? They come in really upset and angry, like they say they've been mom dated into treatment. And as much as our staff is wonderful, we have great clinicians, it's typically not the staff that gets them to sort of buy into the treatment process, it's their peers. They start going to some groups and their peers say, listen, like, it was awful for me too at first, but now I actually feel better and this isn't so bad. Like, do you want to hang out this weekend? We're all going to, the movies, or we're going to this concert where, this is also too the thing with recovery. And I got sober at a young age. I was 22 years old in the city. I still went to concerts. I still went out. There's a lot of sober support networks within these social venues, like at Fish concerts. Most people don't necessarily know this, but actually it is widely known. I don't know if a lot of people know Fish on this call, but Trey is very outspoken about being in recovery. So when you go to a Fish concert during intermissions, you can find like AA meetings, like they're located throughout the concert venues. So we teach kids about this so that they can still have fun and like do fun stuff. Kids aren't going to get sober to be bored and miserable. We need to teach them how to have fun in recovery, and being in a group setting with other kids their age helps normalize it a lot. If outpatient programming isn't working, then you keep increasing the ante, and then sometimes rehab is necessary. It just is. How can you help a child to refrain from using when they don't see the drug as a problem? This is where parents get to be parents and lay boundaries. It becomes much harder to get your child help once they turn 18. Period. I work with adolescents and I work with young adults. The majority of my young adults are still very much financially dependent on their families, so the families still do have leverage. But when they're under 18 and they're living in your house, it is your house. It does get to be your rules as a parent. I would say that if your child is continuing to use, despite the rules and the boundaries that you're laying, any child that needs to be in treatment, and you can tell them they need to speak to somebody and that they will be getting drug tested and all of that by their provider, not by you. It's equally as important for parents to also be engaged in parent coaching and in the treatment process as well, because the therapist can help you with how to lay boundaries with your kids, how to set rules, how to set expectations for your adolescent children as well. Do you offer family therapy? Yes. Any type of treatment for substance use needs to involve the family. We say that the person who struggles with a substance use disorder is the identified patient, but it is not just them that suffers when there is addiction in the family. The whole system suffers. The whole system, it needs to heal. And if they are the only one that's doing the healing, but nobody else in the system is, and they go back into that system, the other members of the system unknowingly and unconsciously can actually do things that push the identified patient back into old behaviors. It's like a mobile, the hanging over a baby crib. When one member of the family makes a change, like gets sober, if the other members don't make changes too, the whole thing goes out of whack. So we need to create a new homeostasis, and family therapy is so important. Okay, I have 2 minutes, right? And I have 2 more questions. I haven't. Sorry, this is a long one. I just not gonna. Okay, this is not an out loud question. Okay. In the presentation, we talk about eating disorders, specifically compulsive eating, hiding food, lying about eating. There's a big link between a lot of our clients who struggle with substance use disorders, have comorbid diagnoses with whether it's eating disorders or disordered eating. There's a fine line between the two. A lot of times we see people put down the substance and then they turn to food, and food becomes their new substance, and they can eat compulsively, or they put down the food and then they start using substances. And usually there's the same underlying stuff that's being medicated, anesthetized, etc. It's tricky. I honestly think eating disorders are in some ways much more hard to treat than a substance use disorder. With substance use disorder, if you don't use, you don't get high, right? You can place the disease in remission. You can't not eat. You can't, and there's food everywhere. Food needs to be a part of your life. So we do a lot of work around intuitive and mindful eating. I mean, we could do a whole presentation on this. I can't really do this question justice in a minute, but it's especially now too, with social media and how much access we have to social media and Instagram and scrolling, we're seeing a really sharp uptick of disordered eating and eating disorders. And there is a lot of crossover in terms of the way that we approach treatment of the two disorders. It's 8 on the dot. I think we did it. And got through all
Thank you. Thank you so much, Amanda. There was so much that I think there were so many misnomers. You know, there's so many things that we believe we know, or things that sound like myths. So I have to say, it cleared a lot of things, and there's a lot of clarity. So thank you.
Yeah.
Thank you very much from the PTSA, from the high schools, and from this community for spending your time and teaching us these valuable things.